Thank you for listening to Brown Girl Table Talk. This is your host, Erica L. Hello, everyone. This is Erica from Brown Girl Table Talk. Today I have with me Miss Trista Brody. She's from True Care Solutions, Inc. Thank you for joining me, Trista.
Thank you, Erica, for having me.
So, Trista, can you start off by telling us a little bit about yourself and what you do?
Well, I am an advocate for the disabled. We offer a wide range of healthcare services and support to ensure all our clients' needs are met.
Awesome. So, with that being said, are you working with adults and children with disabilities, or just more so focusing on adults?
Mainly adults, especially those who are newfound to this new transition of being disabled, unable to work. I do a lot of work with applying for disability, getting, again, services, Medicaid. We do a lot of in-home care services, and again, to help them, again, live and thrive.
Awesome. So I heard just recently that you were featured on Channel 11.
Yes.
Is that
ABC 11.
ABC 11 here in the local area. And what was that all about?
Well, I had a client that we worked with and found through another agency we worked with, and she had been denied her disability twice after having 2 strokes, and disability was pretty much saying, no. And I was like, well, that can't happen. She has to have services. She needs care, and it requires money. So I reached out to Ms. Diane Wilson with Troubleshooter, and she got on the case and helped. And my client was able to get her first disability check this month.
Oh, wow. That is amazing.
Yes.
And, with that being said, we do have a lot of people in the community, especially adults, who initially have been out in the workforce, and for some reason, whether it be mental health disability or physical health disability, have not had the opportunity to work full-time or even part-time jobs. Are those usually the clients that you usually looking for?
Absolutely. A lot of people are just not aware or even familiar with how the whole system works. And that's what I do. I navigate them through how everything works. I hold their hand. I stand with them and just give them that hope that it's going to happen. It may not happen on our time, but it will happen because it's just due. It's something that they have paid into and they are due. And so I work with families, the people, again, that they stay with. I work with them and just, again, get a understanding of, again, how they came to that disability and go from there. So I, again, make sure they have everything they need to, again, survive and thrive.
So what would you say are some of the barriers that our community is currently facing, especially the African American community as a whole, in regards to dealing with disabilities and and some of the disparities? What do you see most of the time?
A lot of times we really, as a culture, and I love my people, don't get me wrong, but we don't want to deal with the elephant in the room. Auntie, has had these behaviors or moods, and it's a mental illness. Whether we want it to deal with it or not, we have to face it and get through it. There's, again, resources, and lack of resources or the knowledge of the resource is the biggest issue I run into. Families don't know what they can get, and that's where I come in at, and I work with them and again for them, because I work with companies, and again, they don't necessarily say they work for them, but again, they work for themselves, and that's to get their bottom dollar or bottom line. Me, I work for the person that is going through that disability, whether it's mental, emotional, physical disability.
Right. So you're able to actually be that bridging gap. You're bridging that gap between make the bridge.
Absolutely.
To
we stand, as we say, we stand in the gap for the disabled, and that is our mission, our goal, and it's never, again, to, bring attention to the disability, but again, that you can thrive. You can live a fulfilling life, irregardless of what, you have been faced with. A lot, like I tell a lot of my clients, you don't get to choose a lot of the illnesses you get. Unfortunately, they're hereditary. You just can't, You're not going to skip it. So let us help you again navigate through these different programs to help you get what you need. And it's no such thing as, I don't need it or I can't get it. No, can't is not in my vocabulary. We're going to get you the help you need one way or another.
Right. So some of the resources you tap into, are there Wake County resources, or some of these resources through independent companies as well?
Yes, I do work with a lot of independent companies. I do work mostly out of Wake County and surrounding counties, but I am very knowledgeable. 12 years of experience, again, working in mental health, social work, and administration in the healthcare arena. I have a lot of contacts, so people, again, in the private sector. And the great thing is, like I said, I work for the client, so I'm there, again, trying to meet a need. So I'm helping the client, and then, of course, that company is able to provide that service. So it's a win-win for everybody in this case.
So with that being said, I know that me personally, just to share, I do have a child with a disability. I do support him financially, but my biggest concern is as he grows older, like how would he be able to help himself, preparing him for job readiness skills. And I have a vision of seeing him going on to college, having his own place and being a productive citizen
Absolutely.
in the community. I even see him having children and things of that nature. Some people look at it as, that's not possible, but I think all things are possible.
Absolutely. And it is there's not a lot of resources, but it's enough out there that he could actually have a job coach, something that he can, again, do, because that whole, sense of purpose is needed for everybody. So have them working, like you said, getting ready for college. All that is definitely needed, and it's resources out there to get him what he needs for that.
So can you tell us some ways that people can make referrals to your business, be able to reach out to you? How can we contact you?
Absolutely. Any way. We're on Instagram and we're on Facebook as True Care Solutions Incorporated. You can call our office at 919-585-1491. Again, 919-585-1491. Again, I'm Trista Brody, the president and founder, so you can always look me up as well. We are definitely involved in the community. We're working on a big project for March in honor of Social Work Month. And so we're really trying to, again, bridge that gap in the community with our disabled individuals. Because, again, we have quite a few people that, again, have some type of disability, and it doesn't stop them from living, again, a productive life. So you can always reach out to us for sure.
Okay. So you're available as well to come out into the community, to churches and things of that nature as well? Yes.
That's my biggest client and resource or a referral source is the churches. I do a lot of talks about self-care, caregiver support is always needed. So I do a lot of workshops, and again, churches invite me all the time how to talk about, again, exercising, staying active when you become, when you're aging, and again, working with how we maneuver the system and things that you need, that are, again, services that are offered to you that you qualify for. You need to know what you qualify for. Right. So give me a call. I have a free consultation. I come to homes, I come to churches, I come to community centers. I'm mobile, but again, you can always call and we can set up a time.
Okay, that sounds great. And just for closing, with your background being in social work and healthcare for how long you've been in there, as well as myself, can you share with me what you think about quality versus quantity? Or most people say quality of health, is more important, or Absolutely. They'll say quantity is better, or what have you. What is your take on that?
Quality over quantity any day. I tell people all the time, it doesn't matter. We travel for what we want or what we think we need. So don't worry about if you have to sometimes go and get that care 30 minutes away, because that is going to give you the best care. I have a great facility I work with, and they're out in Johnston County, and I tell them it's right next door. You go there for the outlet. You can go there to see your loved one or be with your loved one. You don't have to, again, go to these big box, big name places, because sometimes I hate to say it, with especially with healthcare, you can kind of become a number and you fall through the cracks. So you do need quality over quantity when it comes to your health. Point blank, period. You can't put a price on good health and good care. So I'm all about customer service, customer care, quality care. And I'm, again, very, grew up in a rural area, so I know the importance of, again, that one-on-one and that care. So
Right.
I'm very particular about where I go, where I send people, and you have to have a good reputation. If you're not known for, a good taking care of your people, you're not gonna have me
Right.
refer. I can't refer to you. I'm sorry.
And that's funny you say that, because I think that with the healthcare reform and all the policies and the procedures that have changed, the insurance company is more so on quantity. You only have a 3-day stay in the hospital. Then after that, you're gone. There's no real rehab. People are having same-day surgeries. Surgeries are now being cut in half. There's no overnight stay or what have you. People are going home in pain. Do you also have an outlet in regards to connecting people with physical therapists and home health aides and things of that nature when it's time to have that surgery?
Absolutely. I work very closely with a few home health agencies. I do a lot of just helping people in general, because you have to, what I always tell people, especially when you're working with, again, healthcare, you have to have that communication. So if you're having a surgery, you're having something important, big, like a knee replacement, you need to have a plan, a set plan, and they have to give you that. There's no way you can get better without a solid plan. And so I always tell people, especially when you're going into the rehab centers, you need to have a sit down with that group. You cannot just live off the phones and calling and talking and giving updates. You need to have a sit down meeting. They need to have a discharge plan. They need to have all that written out on admission. Do not let people tell you that you don't need that, because you need that. You need that clear communication. I can't stress it enough. People have gone home unsafely, like you said, in pain, and it could have been resolved just by a simple conversation with the discharge planner or with the caseworker. Anybody handling that case, they are mandated to do that, and if they're not doing it, you're in violation of that, and again,
Right.
can be in some big trouble. So I always tell families, have that sit down or have that type of communication. Don't be afraid to bring your notebook and write stuff down, get people's names, find out the movers and shakers when it comes to that, because it's your life. You have that right. And if they have a problem with it, then you definitely need to take your services somewhere else, because somebody's gonna, gladly take care of you somewhere. And like I said, again, I have contacts with the right home health, with the people who actually truly care. And they understand where I'm coming from. And so they know if it's my client, they're going to be right there like, oh, we're going to make sure. And that kind of is disheartening at times, because I'm like, you should do that for everybody, not just the people that are connected to me, because they know I'm a bulldog when it comes to quality care. So, everybody should have
Sounds
that
like you're advocate, you're activist.
Yes,
You're advocating for patients, you're advocating for families, you're a voice for the voiceless.
That's it.
That's so
my
important.
Calling. That's my calling. And I think every time I go to jobs and people were like, Trista, this is just not for you. You have a love for people. And I said, and we all should. We're in a helping profession. Why would I not help the person and do what's right? Because I only hope, again, as we say in social work, you could be on the other side of that desk, and you better hope and pray somebody does that to you.
Right.
So that's why I go very hard. And again, the true advocate, and I've sat at doctor's offices with clients and hospitals and tell them, you're not going to, just throw them out to the wolves. You're going to help us because that's what you're supposed to do. Not because you want to, it's because you're supposed to do that. And so I get that a lot. And again, when people hear my name or see my name, they know she's not coming to play nice, especially if you've done something wrong. And I said, I'm just going to hold you accountable. You're going to do it, or we're going to have to go through the, I've gone to the state, level. I have to do what's right. It's just the only, the right thing to do.
Right. Well, you know what? We really, really, Trista, appreciate your battle call. That's what I'm going to call it. Because it is a battle. It's an uproar. I mean, I've been in the healthcare field for so long, and I firsthand experienced so many different things. And I think that knowledge is power. And like you said, it does not hurt to communicate. And, if to those who are out there right now that have loved ones in nursing homes and hospital, I cannot express or stress to you enough the importance of visiting them on a regular basis, communicating with that facility, holding them accountable for what you're paying for what our tax dollars are paying for what their insurance is paying for. And you're doing that.
I got to do it. And that's like I said, I have been honored, and it's a privilege. I don't take it lightly, because again, I want someone to do that for my loved one and my family and myself when I get there. And like I said, when I get to that point. And so it's something that to me is near and dear to me. Not only dealing with it personally, but you're going to deal with it personally, professionally. It's going to come. Aging and becoming ill is the inevitable. It's going to happen whether we want it to or not. So we need to plan, be proactive, not reactive.
Right.
I get a lot of those cases. All the stuff the bottom has fell out, and that's when they call me, and I'm like, call me before the bottom falls out, and we can be preventative versus trying to fix it. But again, I tell people it's just about knowledge. We perish because of lack of knowledge. And so that's why I always try to educate while I'm helping. I'm doing it simultaneously, trying to help people and educate. And if they ever, again, like I said, reach out to me, call me, hit me up. After our newscast with ABC 11 on the 9th, I got emails and calls because people were going through and they were being pushed aside, and that's not right, because these people have paid and put in their time, and they need this. They need their money. This is what they've paid into, and you can't deny them that.
Right.
They need that to survive, and we just have to be, again, of service. So I count it an honor and a privilege, and so
she
glad.
in here hitting the desk. She is serious about this thing. So if y'all hear a little lump, that means she is passionate. I love her passion. I love her drive.
Yes.
I mean, we need more people out here, because the reality is that we do not stay young forever.
No.
And that brings me to my last question in closing. Do you reach out? Are you willing to speak with families who are, being proactive? They're in their 50s. Or, we in our 30s, and we have parents that are getting ready to turn 60 and 65. Not meaning that they're sick and on their deathbed or anything of that nature, but we want to be proactive. Are you willing to sit down with those families as well?
Most certainly. Like I said, I love to help people in general. I could be at the grocery store, get my oil change, and literally have my name tag on it. Somebody comes, and what we're finding out is that there's generations in one house. You have a millennial, you have a baby boomer, and then you have I don't know what's in between that. I forgot what they call it. I really don't keep up with that. But you have all those generations.
3 generations all in
one.
one.
And you need to know, because, again, it's going to affect you. So I love talking to the youth. I love talking because, again, it's needed. You're going to have to face this. The only thing that's constant is change. And having a loved one who's, again, suffering, showing early stages of dementia or Alzheimer's, or coming to where they're forgetting things, you have to deal with it, whether we want to or not. So I'm always about educating, putting people in front of the problem, and, again, being proactive. So I love that. I speak, again, on behalf of, have been a caregiver. You need to know, if I didn't work in this field, I don't think I could have done it. The type of stress that you're under, because you're caring for that loved one and they're going through changes, you need to know, and you need to have that support. So that's what I'm here for. My team is here for, and I love it. Call me. Like I said, I love to sit down with anybody and help them get through that difficult time.
Well, we want to say thank you again, Trista, for being on Brown Girl Table Talk. Thanks for sharing this time and this opportunity. And this will not be the last time you hear from us. Again, we want to continue to support you. Look for True Care Solutions on any social media outlet. Reach out to Trista. I will be posting her information in our group, as well as on the podcast information. Thank you all for listening, and we want to continue to support our community. Thank you, Trista.
Thank you.